Hello everyone and welcome back to my channel. Today we'll be discussing in short about pediatric fits or seizures. Fits or seizures are nothing but abnormal electrical impulses of the brain. The brain is a very complex organ and it discharges electrical impulses to control various organs of the body. Sometimes if the brain discharges abnormal electrical impulses, then we see fits. Now fits or seizures, they are acute attacks, whereas the word epilepsy is used when these fits are more recurrent and represent a disease. Today, in short, we'll be discussing about simple fits or otherwise called as seizures. The most common type of fits that we see day in and day out are the febrile seizures or the febrile fits. This is one type of fit which is very commonly seen in 3 to 4% of all children. Whenever there is a spike of fever, the growing brain especially, can discharge abnormal electrical impulses, and they are seen as involuntary abnormal movements of the child. These are called as simple febrile seizures. Now, in simple febrile seizures, the episodes are less than 1 in 24 hours, and each episode usually lasts from 5 to 10 minutes. It does not prolong beyond 15 minutes. In complex febrile seizures, the episodes of seizures are more than 2 in 24 hours and each episode is usually more than 10 to 15 minutes. There is another entity called as febrile status epilepticus where the seizures run for a prolonged period of time, not getting controlled by any medication, and sometimes it crosses 30 minutes also. This is a major scenario where usually 2 to 5% of the children among the febrile seizures present with this particular complaint. Now, this simple febrile seizures has absolutely good prognosis and there is no long-term neurological problem. Usually, there are no focal neurological deficits also. By the term focal neurological deficit means some abnormality in some part of the brain, which we usually don't see. This fits or abnormal electrical impulses are usually controlled with some medications. Now, the febrile seizures are classified into 3 types: simple febrile seizures, complex febrile seizures, and febrile status epilepticus. Simple febrile seizures, as I have told you earlier, the duration is less than 10 to 15 minutes and only occurs once in 24 hours. Complex febrile seizures, the episodes are more than 2 in number and vary, and the time duration is usually more than 10 to 15 minutes. Febrile status epilepticus is a term which we usually use if the period of the fit is beyond 30 minutes. Apart from this, the usual treatment protocol involves giving medicines for fever and other supportive care like management of dehydration. And basic blood investigations are done to assess the source of fever. If the fever is because of some systemic infections as seen in routine blood investigations, then an antibiotic may be prescribed. Otherwise, in normal scenarios, control of fever is best done. In some situations where the febrile seizures become recurrent, we usually give long-term preventive medicines. And the most common medicine that is usually used is clobazam. And recently, another medicine that has come up is the midazolam nasal spray. This midazolam nasal spray can control the fit within a very short duration, and this gives enough time for the parent to come to the hospital. Simple febrile seizures and complex febrile seizures have got no long-term neurological problems, but febrile status epilepticus, where the period of fits is usually more than 30 minutes, is sometimes associated with long-term developmental issues. 2 to 5% of children with febrile status epilepticus have been reported to have some neurological problems in long-term basis, but usually 95 to 97% of them will not have any problem. Coming to the other category of fits, fits can also be seen without fevers. This is called as afebrile seizures. And unprovoked seizures have a lot of problems in future. We have to investigate why this particular phenomenon occurs, whether it is due to epilepsy or some other reasons, like a lot of neurological abnormalities also can have this particular phenomenon.